Happening comes up here on the screen, and then afterwards we translate it and give it to the therapist. So they know exactly how to train you afterwards to get stronger.
Wow.
This is fun.
Okay.
So, yeah. So you'll see some of these throughout the building. So there's kind of three environments on this side. One, you kind of see the pediatric mobility environment. So this is actually used to fold up and be able to take away and put in different environments. So a living room, beach, whatever it may be.
I'm the director of the School of Nursing, and I'm pleased to host Dr.Nina Anderson. She's the founder and executive director of Tova Community Health Incorporated, and one of her main foci is the chronic care and disease management for sickle cell patients over their lifespan.
And so I want to talk to you about my journey, where I am today, and sort of what my vision is for the sickle cell community. And I would just like to say thank you to Dr. Sophie Lanscron at Johns Hopkins, who's the director of the adult sickle cell program there, and Dr. Samir Balaz at Jefferson. He's the emeritus professor there, and he was on my advisory committee. And then my board of directors, interestingly, I have two nurses who sit on my board. John Washington, who just recently retired from the University of Pennsylvania, who was a clinical research nurse, and he also had a background in public health. June Grant Stafford, I couldn't be here today, worked a lot in cardiology. She's also retired, and I said, perfect, I need you to be on my board. So, building the capacity for a center of excellence, what's that look like, and where am I today? People with sickle cell disease have red blood cells that are shaped like a crescent, if you can see here the one on the left-hand side. In 2014, I was able to get some grant and aid money to start a specialty care clinic medical home. And I'm located on 40th and Market Street, which is in the third highest zip code population for docs with sickle cell. And I also go down to Dover once a month to see the students at Delaware State with sickle cell anemia. And that's one of the postcards that I have out as well. So, my organizational structure. Having conversations with the Nurse Managed Center and many people that are committed to providing care for vulnerable patient populations. If you look closely at my organizational structure, it's pretty much the same as a Nurse Managed Center, but I don't call myself that. And that's only because the difficulties and challenges that I'm having now to say, hey, I'm not here to take your patients, I'm here to provide quality care for a patient population. It's still the same, it's putting the nurse at the center of care coordination. I have consultants, the regional hematologist. I'm working on a partnership with a local hematologist, and I have a medical director. I also have a social worker that comes to the clinic twice a month to see patients with me. provide psychosocial assessments, as well as therapeutic counseling to patients. And I also have an advisory outreach committee and a support group that I started. But it's still the same. It's nurses at the front line of providing care for